This is All Things Fitness and Wellness, uniting industry thought leaders and fitfluencers on the mission to inspire innovation and encourage people to live a life fit and well. Brought to you by Fitness World, your fitness, your way. Visit fitnessworld.ca.
According to the World Health Organization, 1 in every 8 people around the world live with a mental disorder. Mental Health America reported that between 2019 and 2020, 21% of the adults in the United States were experiencing a mental illness. That's equivalent to 50 million Americans. In Canada, the statistics aren't much better. The Canadian Mental Health Association reports that major depression affects approximately 5.4% of the population and anxiety disorders around 4.6%. And the numbers coming out of COVID are only becoming more alarming. In March, a report was published in the British Journal of Sports Medicine, which explored the effectiveness of physical activity interventions for improving depression, anxiety, and distress. In this episode, lead researcher Dr. Ben Singh joins us from the University of South Australia to explain how exercise can be more effective than medicine to manage mental health. When it comes to the current advocacy efforts in the fitness industry, politicians and potential advocates are looking for evidence-based reasons to show their support. That is why peer-reviewed publications such as this are so important to moving the message of exercise as medicine forward. In this episode, Dr. Singh is going to share some of the key research findings and talks about his reaction to the media attention that this study has garnered, including how he found out it was referenced on the Joe Rogan podcast. Before we get to it, be sure to hit like and subscribe. We have new podcast episodes weekly. Plus, we're continuing our gym and wellness haven tours that feature inspiring founder stories. I'm your host, Chrissy Van, and we're on a mission for everyone to live a life fit and well.
So appreciative to have you. It is Mental Health Month here in Canada. And so we're really just bringing awareness to elements that we can do and incorporate in our life to combat those struggles. But I'm curious because I know that you have done a lot of research papers involving physical activity. Why is this such an area of expertise for you? And why was this your focus?
Yeah, so I've always had an interest in sport and exercise from a young age. So just sort of growing up, playing different sports, playing football mainly, and just also having, particularly my dad has been active his whole life, and now he's in his 60s. He's sort of continuing to sort of run around with his grandkids. He's still full of energy. So I think just seeing that, having that sort of personal connection to seeing someone who's been active their whole life and how it's benefited them has really just had an impact on me. And so it was just a natural fit to be able to find myself working in a job where I'm able to sort of evaluate all the different benefits of exercise. And so we know, I think we've all experienced maybe that we've sort of gone out for a run and then immediately after we've had that boost in mood and we felt better about ourselves, or maybe a day where we didn't feel like doing exercise, but we sort of dragged ourselves to the gym and we've just felt that immediate benefit of getting out and getting the body moving. And so when the opportunity sort of came up to assess and investigate all the different physical and the mental benefits of exercise, it was just a great fit for me and something I have really seen sort of the value in, both personally and professionally.
Well, and you always see those quotes, you never regret going, or when I've even been going around and doing gym shorts for our YouTube channel, almost everyone says, oh, it helps my mental health. I just feel better, but they maybe don't necessarily have the data or information as to why. So I know this is something you've actually been able to look at, and we've seen the headlines from your study, which basically is saying physical activity, often better to combat than actually applying medicine. So talk to me a little bit about the study that was executed.
Yeah, so what we did is we wanted to evaluate all the existing evidence that's been published on the benefits of all the different types of physical activity on mental health symptoms. So mainly we wanted to look at depression and anxiety. And why we thought it was important to look at the depression and anxiety is because particularly as a result of the pandemic, this last few years worldwide, there's been increases in the rates of people experiencing symptoms of depression, anxiety, and it's particularly prevalent in Australia, but also, as I mentioned, worldwide. So, and we've known for a long time that exercise and physical activity has a whole range of benefits, and there's so much research out there being published So we wanted to try to summarize all that existing evidence in sort of one nice report. And so we went out and did a search of all the existing studies that have been done that have looked at basically any type of physical activity. So we didn't want to just focus on the common exercises. We wanted to look at what else is out there. And so we summarized all the existing evidence, and there's been quite a lot. And we basically found that when summarizing all the evidence, that basically any type of physical activity is good, whether it's going to the gym, lifting weights, just going for a walk in your neighborhood. And also what we found was quite interesting is that, particularly in recent years, there's been a lot of studies published looking at the benefits of exercises such as yoga and Pilates, and they've been shown to be extremely beneficial for particularly mental health outcomes such as depression and anxiety.
So have there been any particular movements or exercises that correlate in benefiting more? Like when it comes to depression, is there one that's better for that? When it comes to anxiety, is there something better for that?
Yeah, so we did look at that, and what we found was that when specifically looking at depression, the evidence suggests that resistance exercise, so lifting weights or going to the gym, doing any type of weightlifting exercise, tends to be the most beneficial for depression, whereas yoga and Pilates tends to be the most beneficial for anxiety. But I think the important message is we don't want people thinking that in order to specifically get benefits, we need to focus just on that one type of exercise. We know if we want people exercising for a long period of time, for the rest of their lives, and we know an important predictor of people continuing exercise for a long period of time is that they need to perform an exercise or a physical activity that they enjoy. So if they've got a particular interest in yoga, or they're an enthusiastic cyclist, or they love running or going for hikes, whatever it might be, it's important that people try different physical activities until they find something they enjoy. And again, just because the evidence suggests that resistance exercise might be the most beneficial for depression, we know that there's a lot of individual differences. So some people might really love lifting weights, some people might not prefer it as much. And so I think it really emphasizes the importance of maybe doing a range of different exercises, because we know that there's unique benefits for different exercises. If we want to improve our aerobic fitness, we need to do some aerobic exercise. If we want to improve our strength, then we do need to sort of incorporate some resistance exercise. And we know there's a lot of benefits, for example, looking at flexibility for things such as yoga and Pilates. So really, we didn't want people getting the wrong message for them to sort of maybe focus on one exercise for depression. It's really trying a range of different physical activities. And as I said, when we looked at all the evidence, basically every type of exercise and physical activity was beneficial. So there wasn't really a right or a wrong type of exercise or physical activity that people should be doing.
So kind of knowing all this information, something that we talk about a lot here, for example, in Canada, 84% of our population is not getting enough movement, which is our minimum 150 minutes a week. I know that this is a problem that's seen in a lot of areas around the globe. So when you hear that, knowing what you know, what comes to mind?
Yeah, so we have similar statistics in Australia where a lot of people are just inactive. And I think, yeah, it's all well and good to do the research to say that physical activity is beneficial. We need to get out and exercise. But really the next step is identifying why people aren't active. So whether there's certain barriers to exercise, maybe they live in a neighborhood where it's not sort of feasible or not safe for them to go out walking regularly. Maybe they don't have access to a gym, or they sort of lack the education on how beneficial exercise is. So I think the next step is to really try to answer those questions and to identify why aren't certain people active and what can we provide and what resources can we provide them to help them be more active. And I think just going back a step, so when we looked at all the evidence, we included over 1,000, so our review included over 1,000 different exercise studies involving over 120,000 participants. And what we found was the most common exercise that was evaluated in all these studies was walking. So just sort of going out in your neighborhood and going for a walk. And that was shown to be extremely beneficial. So it really highlights that you don't really need fancy equipment. You don't need to buy an expensive gym membership. although those things can be beneficial and a lot of people enjoy them, really just starting off, if someone's not active, just starting off with a 10 or a 15-minute walk each day, or just trying to integrate some extra activity throughout their day. So maybe trying to fit in a walk during their lunch break, whatever it might be, anything that gets the body moving is the best place to begin.
Definitely. And it is really about getting people from no fit to low fit and something that is very accessible. When people are hearing about the studies, how is mental health measured? How do they go from taking the exercise to that result that it was, quote unquote, good for mental health?
Yeah, so almost all of the studies evaluated either anxiety or depression just with self-report surveys. So these are surveys that are validated and used to assess anxiety and depression in clinical settings. And so often what will happen in the studies is that people will complete the survey at baseline, then they'll do maybe a 12-week exercise intervention, and then they'll assess again using that questionnaire. So it's just a self-reported questionnaire where they assess their symptoms. And it was interesting. So the review included over 120,000 participants, and there was a whole mix of different conditions. So a lot of the studies involved people with the diagnosis of breast cancer, HIV/AIDS, kidney disease, diabetes, people with actually diagnosed depression and anxiety, and also healthy adults. And the evidence showed that physical activity was extremely beneficial for improving anxiety in people with HIV, breast cancer, and kidney disease. And I think that's important because it just shows how potent exercise is. Usually people, if they're diagnosed with a life-changing medical condition, it's quite a stressful time for them and they might experience heightened depression or high levels of anxiety. And the evidence shows that one of the best things they can do is be active during those periods, whether they're going for their treatments or they're receiving any other forms of medications, that can be extremely beneficial. And what was also interesting is that a lot of the studies involved in what were otherwise termed healthy adults, so people who don't have a diagnosis of mental health conditions or don't have a diagnosis of any other condition. And even among those individuals, physical activity was shown to be extremely beneficial for improving symptoms of depression and anxiety. And I think that's quite important because I think a lot of people experience days throughout the week where they might be feeling a little bit down, or they might be experience a lot of stress at work or in their personal life, and their anxiety has gone through the roof. So even though they haven't been diagnosed with a mental health condition, they might just have periods throughout the week where their mental health is struggling a little bit. And so the evidence shows that one of the best things you can do is keep active during those periods. And I think I know for myself, if there's periods where I'm extremely busy with work and I've got a lot of things going on, that's often the periods where it's most difficult to fit in some exercise because I've got so much work to do. I've got all these other commitments. But really what we need to be doing throughout those periods is just finding maybe 10 minutes a day or 15 minutes a day and just investing that in a short bout of exercise, because that will be extremely beneficial in helping our symptoms.
Given that this is such your area of expertise and having the volume of research that you were able to intake, were there any other findings that truly surprised you out of this?
Yeah, so we looked at the intensity of the exercise as well, and we found that low, moderate, and high intensity, they were all beneficial for improving depression and anxiety. But what was really interesting is that there were greater benefits with greater intensities. So moderate intensity had greater benefit than low intensity, and the highest benefits were seen in high intensity exercise. So it really emphasizes the importance that low intensity exercise, so just going for a walk around your neighborhood, can be beneficial. But if we want to really experience the optimal benefits, that we need to be integrating high intensity exercise, which again, if someone's never done any exercise before and they don't have a previous history of being active, then the best place for them to begin is just starting off with low sort of intensity and then gradually progressing over time. But if someone's been doing the same exercise routine at sort of a low or a moderate exercise intensity for a few years now, then really we want them to be progressing their intensity. So trying to have a few days a week where they take their workouts to a high intensity, and that will help them to sort of achieve the optimal benefits.
Fitness World's 16 British Columbia high-value, low-cost gyms are committed to helping people reach their fitness goals, whatever those may be. Exercise and movement play a pivotal role in supporting people's overall health and wellness, and it is Fitness World's mission to provide the facilities, services, and amenities to help you achieve your fitness your way. Visit fitnessworld.ca for more information.
Well, and one of the big discussions that we have here, because if you are someone that's struggling with your mental health, obviously we know therapy can be an excellent route. But if you're heading to a doctor's office, most of the time they tend to simply prescribe. And so you're given a medication, and obviously that's quite helpful to people. But one of the things that they never do prescribe is a prescription for exercise. I know there are a couple test runs in certain populations and areas where they're doing this, but this isn't common practice. I know, working a lot with the health club industry and the gym industry, this is something a lot of them are pushing for. So when you're doing this research, were all the individuals that were part of the self-reporting free of any of those medications, or how were they divided in different groups? How do you stack it against using an antidepressant, let's say, or anti-anxiety medication?
Yeah, so a lot of the studies that we assessed didn't report that level of detail of whether the participants in the studies were on medications, but all the studies, so there were quite a lot of studies that involved people with a diagnosis of depression and anxiety. And in those studies, if participants or patients are currently taking medications, then they continue those medications in addition to the exercise. But you're definitely right. So in terms of how commonly these medications are prescribed and how little exercise is prescribed. And I think if we put ourselves in the shoes of someone who's experiencing severe depression, often they suffer a lot of fatigue, so they struggle to get out of bed in the morning. They just doing their daily tasks are extremely difficult, and they lack the motivation. And often if someone tells them, the best thing you can do is exercise, it's really the last thing they want to be doing and the last thing they can think of doing. So it's quite difficult. And if you give these patients the option between taking a pill or getting out and doing some exercise, often the pill or the medication is sort of the easy option, and particularly if they don't have a previous history of exercise and they've never exercised before. So it's extremely difficult. And as you mentioned, just going back to the doctors, a lot of the times they just don't receive the training in terms of prescribing exercise. And it's quite often a lot easier for them to prescribe a medication. And so I think that's why exercise is so valuable and so potent, because a lot of these medications have a lot of short-term side effects, quite negative side effects. And often the long-term side effects of these medications are unknown. But if we think about physical activity and exercise, there's not just the mental benefits, but there's all the additional physical benefits and the long-term health benefits, such as a reduced risk of cardiovascular disease, reduced risk of diabetes, improved energy, improved muscle strength. The list of benefits of exercise is just endless. And so I think that's really why exercise is so potent and so valuable. And as we spoke about earlier, it can be free. You can just walk out your front door and go for a walk around your neighborhood and experience the benefits. It doesn't require having to go to a GP and getting a prescription.
No, and I think you make such a fair point too, because I can imagine if you're really struggling, if your doctor all of a sudden said, go for a walk around the block, you probably would feel a little bit of conflict with that recommendation. So that is absolutely fair. I'm curious to know, because you have garnered so many headlines from this study, and I think it is because we're really building this bridge of the fact that out of COVID, there is a massive mental health crisis on our hands, and you're highlighting the fact that this is a substantial finding, that this actually does work. And so Joe Rogan ends up talking about your study on his show. Talk to me through how you found out that this happened and what was the reaction, because that's a big deal.
Yeah, it was really unexpected, actually. So I think the media attention for this article, we knew it was important research, but when you get this level of media attention, it's really unexpected. And so, I didn't actually hear about the Joe Rogan mention until about 2 or 3 weeks after the episode had been aired. And it was just actually someone on Twitter tagged me. And I sort of just woke up one morning and my sort of phone was just getting all these notifications. And so I checked to see what was going on. And I saw that it had been mentioned on the episode. So it's quite a sort of good feeling, because when you do this research, you don't want to just publish it and have no one read it. Really, you do this research because you want it to get out to the public, and you want people sort of getting the message and being aware of the research. So I think anytime you can get a bit of media attention, it's always, it's nice. Yeah. And it's a good way of sort of getting the message out there as well.
Definitely. Like from this research, as you talk about getting the message out, what would you ideally like to see come out of this? Even once all the circulation through the media is quieting down, what do you hope goes forward?
Yeah, so I think so as you sort of brought up earlier, one of the things the message we don't want people getting is it's not a case of exercise replacing these medications. So if someone is currently receiving treatment and medications for their depression or their anxiety, it's not a case of just stopping those medications and starting exercise and that'll solve all their problems. Really, it's about working with their doctors to come up with an appropriate treatment plan. And as you mentioned, so currently there's very little talk of exercise when it comes to GPs prescribing it for their patients. And so this research, what we really hope will happen is just hoping that exercise is now included in that conversation when doctors are prescribing treatments for their patients. So that might include discussing various treatment options, which might include some type of therapy, maybe a small dose of medications, and then some lifestyle changes such as sort of integrating some physical activity into their lives. So we really hope that it can help exercise be included in that conversation. So instead of just relying solely on medications as the only form of treatment, just including exercise in that conversation and getting their patients to sort of be active. And also, as we said before, so there's all the evidence out there, but it's about trying to identify what support do these individuals need to become active. Do they need to see a personal trainer, an exercise physiologist, or any other exercise specialist to guide them and support them to help them be active, or any other support that they might need? So it's a good question. It's really about trying to include exercise in that conversation when we are thinking about treatments for mental health conditions.
Well, and one thing that's taking place in North America, twofold on both sides of the border. So here in Canada, for example, there has been the Fitness Industry Council of Canada that's been advocating. We have a tax line where essentially you would be able to use a gym membership as a medical expense. And then conversely, in the United States, they've been pushing to basically have it included in their healthcare spending accounts, again, as a medical expense. So what are your thoughts? I mean, I think I can tell by what you're saying there of basically including the fact that physical activity should be part of the healthcare continuum.
Yeah, definitely. I think anytime the changes can be implemented that sort of incentivize people to maybe join a gym or be active, are definitely sort of good things that we want to see happen. So sort of financial rewards, or just things that sort of make it more easier for people to be active and receive that support. So maybe receive advice from an exercise specialist. So definitely good changes. And I think we are moving in the right direction. As you mentioned, there are sort of case studies all around the world where you hear positive changes happening that can help people become more active. And so I think we're moving in the right direction. It's probably just going to take a little bit of time, because it's not just going to be an overnight change where all of a sudden every doctor's clinic is prescribing exercise. So I think the evidence is out there, and now it's just sort of about promoting the evidence, increasing awareness of the benefits of exercise. And then, as we've seen around the world, slowly but surely, I think things will head in the right direction.
Well, and your research study has caused such a ripple. So I'm curious to know, within the work you do, what's ahead for you? What are you working on, or what are you hoping to bring to the forefront this year?
Yeah, so we're looking at various ways to sort of get people active, particularly using digital technology. So we're doing sort of more and more research on how devices such as Fitbits and Apple Watches, how they can sort of further be used to keep people active, because we know there's a lot of evidence to show that things such as Fitbits and Apple Watches and other devices, all these apps, are quite beneficial, particularly because we're spending so much time on our phones. If we can include apps or sort of any other features on there to help people get active, then they can be quite beneficial. So that's sort of the main thing. And also looking at sort of chatbots, so how they can be used to help people exercise and become more active, because we know there's been sort of all this talk lately about particularly ChatGPT, but all these other sort of AI technologies as well. So trying to do some research into how those technologies can be used to prescribe people individualized exercise programs, how to keep people motivated over time, because we know quite often people, particularly people who don't have a previous history of exercise, a lot of the times they may start a new exercise program and they start off on the right track, but maybe 3 months or 6 months down the track, they're back into their old habits. So it's definitely thinking about how we can get people active long-term, because we don't want people just exercising for 12 weeks and experiencing some benefits and then falling back into their old habits. We want to promote lifelong exercises. So thinking about how we can sort of use technology to support that has been a growing research area.
Well, and I can tell that you have so much passion about this space. What have been some of the most notable findings for you once you've niched into researching the benefits of physical activity?
Yeah, so I've been fortunate to do research in a range of different sort of medical conditions. So I've done a lot of research also at looking at the benefits of exercise with breast cancer, women with breast cancer. And so historically, just sort of 20 years ago, when a woman was diagnosed with breast cancer, often they were told that the best thing they can do is rest, and that will sort of help them. So avoid any strenuous activity because that will make their symptoms worse. But really, over the past 20 years, there's been a lot of evidence to show that one of the best things that women can do after being diagnosed is to keep active. And that's a combination of aerobic exercise, resistance exercise, and some flexibility exercises as well, because that can help them get through their treatment. So particularly if they are going through chemotherapy, by being active, it can help them tolerate the treatment and complete their treatment. And it helps maintain their physical function. It helps maintain their strength, their mood, and their mental health as well. So there's a lot of evidence to show that not just breast cancer, but even in recent years, a whole range of other cancers, that exercise is one of the most beneficial things that can be done during and after a cancer diagnosis. So that's been quite an exciting area of research. And I think another thing, so going back to the review that I was talking about earlier, we did also look at the duration of the exercise interventions. And we found that so we looked at sort of interventions. We divided the studies as sort of interventions that were less than 12 weeks and greater than 12 weeks. And what we found is that the optimal benefits in terms of depression and anxiety tend to be achieved around that 12-week mark. So it shows that people don't necessarily need to exercise for 12 months or sort of 2 years in order to achieve the mental health benefits. They can be achieved relatively short term. But again, we don't want people getting the wrong message to think that I just need to exercise for 12 weeks, I'll achieve the optimal benefits and then I can stop. We really want them exercising for the rest of their lives. So I think the way to look at that is by sort of exercising for a short term, you can experience those short-term benefits in your mental health and physically as well. And then by continuing long-term, you can maintain those benefits and achieve a whole range of other longer-term benefits. So I think we could talk for hours about sort of all the different aspects of exercise, what's good, what's bad, but they've sort of just been some of the key things that have stood out in terms of some of the exciting research findings.
Well, and I think what you're saying there as well, and you know this as well as somebody that likes physical activity, when you do experience those benefits, you want to keep going. You always see the things of people, I don't feel like it, I don't want to go. And it's definitely difficult to get started. But once you do and that momentum builds and you do feel the benefits of your mental health, and then you start to see the physical changes within your body, it's its own medicine to make you want to just keep going.
Yeah, and I think so. It raises an important point. So you're definitely right. And I think a lot of people who are experienced with exercise, who have been exercising for a long time and who are used to doing maybe high intensity exercise. So let's say there's someone who's been exercising regularly and they do 60 minutes a day at a high intensity. Often what we see is that if there's a particular day where they can't fit in their 60 minutes, they might think, oh, it's a bit of an all or nothing approach. If I can't get in my 60-minute workout, then there's no point. So I'll just skip my workout for today. But the evidence shows that even if you only have sort of 10 or 15 minutes that day to squeeze in a quick workout, then that's better than doing nothing. So it's really not an all or nothing approach. If you can't fit in your usual workout and you have to fit in maybe a 10-minute workout, then just doing that is better than doing nothing. And again, that helps sort of just reinforce that habit. So I know for a lot of people, sometimes it can be a slippery slope where if they miss one workout, then they've missed two, then they'll miss another one, then all of a sudden they've missed a week or 2 weeks of exercise. So really just keeping active every day and trying to fit in a little bit every day is just an extremely effective way of just staying in that habit and that routine.
Well, I always love leaving every conversation with a motivational quote, and you teed me up perfectly there. I know it puts you on the spot, but if there's people that are struggling to get going, what's a little motivational nugget of wisdom that you can leave us with?
I think just do anything really, like anything that gets the body moving, and it doesn't necessarily need to be 30 minutes a day. Even just going out for a 5-minute walk is a perfect place to begin.
Well, thank you so much for sharing a little bit about that study. Congratulations on the momentum that it has garnered. I think it's so important for people to make the correlation. You and I are part of it, so you know what it does, and you just kind of hope that other people get to experience those benefits because it truly makes a huge difference.
Thanks for having me on. It was a pleasure.
You've just listened to All Things Fitness and Wellness. This episode was brought to you by Fitness World. Your fitness, your way. Don't forget to hit like and subscribe so you never miss out on hearing from industry thought leaders and influencers. We are on a mission to help everyone live a life fit and well.